Right. Well, when you have a pet, sometimes what can happen to you and, become issues over time can happen to them. And you may not be thinking of those certain things. So Dr. Michael Mixon with Texas Veterinary Hospital is here to tell us about a common issue that can affect dogs more often than people think.
Exactly.
Thanks so much for being here. Who do we have here?
This is Fry.
Hi, Fry.
And Fry is a 7-year-old German Shepherd mix. He's already been neutered. And he is looking for a new home. Now, he does have heartworms, but they're being treated. Animal Defense League is taking care of all that, and they'll take care of all the costs associated with that, too. So he is good to go. He looks great. He's very well-mannered, and he'd make a great addition to somebody's house.
Such a sweet disposition. He's been here already for a couple of hours, and just so precious, so quiet, and as you mentioned, whoever does adopt Fry, and when he finds that forever home, and that's what we're hoping, does not have to worry about, the heartworm situation.
Exactly.
They can get that treated. So, all right, so we're talking about knee problems in dogs.
Yes.
Tell me a little bit about what it's called.
Well, the official name is a luxating patella.
Okay.
And it can either be medial or laterally luxating patella, which basically means the kneecap either dislocates to the inside or dislocates to the outside of the knee. And on dogs, people don't know this, but this area here is the knee. We call it the stifle instead of the knee. And many times, especially in small breed dogs like Chihuahuas, Poodles, Pekingese, things like that, their leg structure is such that it predisposes them to having their kneecap pop out of place.
Because they're just smaller?
They're just smaller, and the anatomy that helps support the ligaments. Now, what we see on the x-ray, actually it's a little bit difficult to see, but when we have those knees flexed, sometimes you can see the kneecap is right to the inside. Like this is the kneecap right here, and it should be over here. And he also has it right here. And then this is the normal anatomy, and this is his kneecap, this is his femur, and this is the tibia, and that's everything in the proper place. And then you can see the groove where it's supposed to be is right there, and then it moves to the inside, or in this case, to the outside. And so when that happens, subtly, in the small puppies, you don't really notice anything, except for maybe when they're running, they'll skip a little bit. They'll hold their one leg up, they'll run a few strides.
A sign. So that could be a sign that that's an issue. They're not just skipping for joy. When you go, oh, look how cute it's skipping along.
And then sometimes they just don't want to jump on the couch anymore.
Right.
And so because they lose confidence in that knee, so when they go to push, instead of all the force going straight down, their knee bows out.
I see. And
then sometimes we don't see them until they've actually caused a sprain or tear some cruciate ligaments in there because they don't have the proper support that the knee needs. And so depending on the severity, we can treat it either medically with some joint supplements or things like that, or surgery. And that's something that we can definitely take care of if that's a problem.
Yeah, I know, baby. Okay, so you mentioned surgery. How successful is a surgery for positive results?
The expectation is about 100%. They should be back to their normal function after the surgery. It's different than some of the other knee surgeries, like for cruciate ligaments and things like that. But with the patella surgery, the expectation is to get them just back to 100%. And so it's very high, and they do very, very well with that. And it also prevents the arthritis formation down the road that they would get without the surgery.
All right, Dr. Mixon, thank you so much for all that information. And tell folks where they can adopt Fry.
Animal Defense League. And he is ready to go as soon as he gets back.
All right, there's the phone number on the screen for Texas Veterinary Hospital, 349-2121. That's 349-2121, or head to texasveterinaryhospitals.com for more information. We'll be right back with more.